Thank you for keeping it on Great Day SA. Clogged arteries and reduced blood flow are not uncommon conditions that people are faced with in San Antonio. Here to help us learn more about peripheral artery disease is Dr. Jeff Martinez. Doctor, thank you so much for being with us today.
Yeah, thanks for having me.
Absolutely.
Go Spurs, go.
Go
So
Spurs, go. Thank you for, embracing the Spurs love today, as we are going to talk about something pretty critical and important for our audience. You're a vascular surgeon, which means that you take care of blood vessels. And with that, you do a lot more to take care and make sure that people's arteries are in good condition, their blood is flowing. Can you describe a little bit about what you do?
Sure. So I'm a vascular surgeon, and that is a specialty in medicine where we treat the blood vessels, and that's everything but the heart. And our particular focus, we really focus on circulation to the leg and those blood vessels that affect problems in the legs.
Yes, and I know a lot of people in San Antonio do struggle with diabetes and other heart conditions, blood, conditions as well, and PAD is one of them, right?
Yes, it is. So our community, there's a lot of diabetes, and diabetes unfortunately does affect the vascular system, especially the smaller blood vessels in the legs and feet, and so we see a lot of problems with feet, toes, legs.
And is that part of the condition that PAD is underneath the realm of PAD?
Yes, it is. It is PAD. It's just that diabetes tends to accelerate that process and make that condition worse.
Well, what kind of symptoms would someone know? That's the thing. Sometimes there are none, right?
Right. There can be none. Most of the time there are none until the condition gets more advanced. And some of the earliest signs that we'll see is pain in the calf area or thigh area when they're walking. A lot of times we don't see that in diabetics because it's a smaller blood vessel. The next kind of step up from that is what we call rest pain. So you may have pain in the toes or the feet that's constant. It may only happen at nighttime when you're in bed, when you're lying flat and don't have gravity pulling the blood down a little bit. And then the next more advanced form of this would be where you have tissue loss. So you may have non-healing ulcers, and in really severe forms you have toes that turn black or spots on the feet that are turning black, and that can be early gangrene, and that's pretty dire.
Yeah, that is very serious, and that is where combined experience with you and your team can really bring good care to your patients, right? Can you describe a little bit about your team?
Sure, yeah. So it all starts with a phone call. We have real people that answer the phone and talk to you. Nowadays, there's more trouble getting patients into the office with different insurance plans and issues, and our people really work to make that process as easy for the patient as possible. When you come to the office, you see me. I'm the person you see, and we'll evaluate you, and because it may not be vascular disease, but we'll work to figure out what's going on. And then our team will be the ones to take care of you. And we're a small group, but we have over 125 years of experience among all of us treating just vascular problems. So it really is our forte.
Very incredible. I know that if people have signs, definitely give y'all a call, visit your website, give you a call at your phone number, 210-540-6766, and then they'll be on their way to at least taking good care of their health. And you have a few locations as well for people in San Antonio to visit, correct?
Yes, we do. Our main office is off of Barlight Boulevard in the southwest part of town, but we also have an office close to the medical center and out east.
Well, thank you so much for being here and providing such important information to our audience.
Thanks for having me.
All right, everyone, stay with us because